Hey, welcome to the channel and the podcast. This is the Recharge Podcast. I'm also sharing this content, obviously, on the YouTube channel here. And it's November, so we're talking about men's health topics. Some of this familiar, some of it not, but I hope you gain some value. This is an educational series I put together, and I look forward to sharing with you. Take care. Be well. Hey, welcome back to another episode of the Recharge Podcast. We are in November, and keeping with the theme, we are going to stick with the men's health topic. This topic is going to be, unfortunately, a little bit more scientific. I will try to keep the jargon to a minimum and explain it clearly and maybe a bit slower than I normally talk. But endocrinology is complex and complicated for the best of us. And so with that in mind, I just want to take a moment to define what we're talking about in this episode. It relates to low testosterone, but I want to kind of broaden it a little bit further into hypogonadism. And what the heck is that? Hypogonadism is a medical condition that's characterized by inadequate production of sex hormones in the testes in men, since we're talking about men's health this month. This deficiency can lead to a variety of symptoms and health issues, just depending on whether it occurs in the testicles themselves or somewhere else in the body, in this case, the brain. There is a structure deep inside the brain called the hypothalamus. Also, there is a structure called the pituitary. These coordinate production of hormones throughout the body, including the testes, or the testicles, if you will. So just depending on what's going on in men, typically we see signs of decreased libido, loss of interest in sex, erectile dysfunction, infertility, loss of muscle mass, fatigue, and mood changes. These are huge issues in men's health that often can be overlooked or attributed to other causes without actually digging in. I've seen, unfortunately, some men in their 20s that have had some what's called primary hypogonadism, where their testicles, for whatever reason, are just not working properly, and they're labeled as depressed, or they're told that they need to motivate themselves. And the whole point is that the underlying diagnosis was actually missed in the treatment. Once it was finally discovered that it was a testosterone issue, is easily addressable. So let's just jump into some information here. So as men age, their sex hormones, particularly testosterone, naturally decrease. This condition, over time, is called hypogonadism, and it's obviously different in men than women who are going through menopause. Typically in men, it starts around the age of 30, and testosterone levels are believed to drop about 2% annually. So you can do the math on that based on your age and kind of come up with an idea of how much it might be lower today versus when you were in high school. It's important to understand there are differences in hypogonadism. Young men can experience it due to issues of genetics, testicular failure, like I alluded to in the example above, but usually in older men, it's often due just to the aging process themselves. Can be some lifestyle factors that impact that as well. Fortunately, men, it tends to be more of a gradual decline instead of just an abrupt disruption, unless it's due to something like testicular cancer, testicular surgery where one is removed for some reason, or trauma, or there is a condition called torsion where the testicle will twist on itself, and if not addressed promptly, the testicle will die, and that will be another driver of the hormone disruption that I alluded to earlier. There are several uncertainties around late-onset hypogonadism. It's still unclear whether symptoms are due to lower testosterone by itself or aging or a combination of both. So there's a little bit of debate around the benefits and risks of that. You'll find lots of things in the literature about that. There is a book by Dr. I think it's Morgan Taylor that talks about testosterone therapy, and I've read it, and I've actually heard some of his colleagues speak at conferences about it. So it's something that has to be discussed on a frank and personal level with individual one-on-one physician. Unfortunately, I've seen some men that have gotten testosterone on trips down south across the border and have been willy-nilly administering it themselves with some pretty catastrophic side effects, which I've shared in previous episodes. So I don't want to belabor that point. But how common is this hypogonadism that I've been talking about? Can affect anywhere from 6 to 39% of men over the age of 30. The chances increase with age and are pretty consistent across different racial and ethnic groups. So the way it's diagnosed, very straightforward. Just a survey of symptoms like anything, loss of libido, decreased energy, fatigue, loss of muscle mass, and then blood testing. The best way to measure testosterone is before 10 a.m. in the morning. Like most hormones in the body, there is sort of a pulsatile release, a surge and decline of the hormone itself. So most labs would recommend doing an initial test before 10 a.m. And if it's low, repeating that, say in a couple weeks, just to confirm that this is actually accurate before just jumping right in with testosterone replacement therapy. There are other things that can be done besides testosterone injections or gels. We'll save that for another video, but I just wanted to bring those to mind to make sure that you have a clear understanding that there are multiple options. So treatment, when it comes to this, clearly everything has a defined risk and benefit of it, but treatment can improve aspects like mood, sexual desire, libido, body composition, energy, brain health, brain fog. All those things are critical to the wellness and longevity and quality of life for men. It's also important to understand that there can be some impact related to heart issues and prostate issues. So I can't issue just a blanket statement here. This, obviously, like anything in medicine, needs to be individualized, and I'm just hoping to bring forth some information and education here during Men's Health Month to help you think and contemplate and have a little bit more information for discussion with a personal practitioner, whether that's physician, nurse practitioner, PA, etc. So just to wrap this up here, hypogonadism, low hormone, low testosterone, it's influenced by aging in men, can affect their hormone levels and their overall well-being. Recognizing the symptoms, which I discussed, and discussing these on a professional basis with somebody who knows your history, your medications, your lifestyle, all those things are important not only to diagnose, but also to rule out other potential causes, which could be more serious, and also come up with an individualized approach. So hope you found that helpful. Be safe, be well.